How would I answer a colleague who is stating they don't have enough time to address colorectal cancer screening in every visit? First off is understanding that colleague's perspective. I've been a part of practices where the emphasis was more on volume, the volume of patients seen per day. And so being required to see 25 to 30 patients a day can make it difficult for providers to focus on screening, colorectal cancer screening or any other cancer screening for that matter. And so there is a volume number that allows providers to still focus on good quality patient care, but be able to see the right balance of patients. And so the first step is just understanding the pressure that's put on them. The second step is helping them understand that it's going to be a team-based approach. So most of the discussion is not going to be on their shoulders alone. There are going to be patient navigators, their medical office assistants, even front desk staff will be taking part in the discussion. What we need from the provider more than anything is just their recommendation. If they can co-sign on what their medical assistant has talked with the patient about, if they can endorse their patient navigator's recommendation to the patient, that goes a long way. Having the provider agree that yes, it's a priority and they should do it means everything. And it doesn't take but 30 seconds for a provider to say, yes, you should get the colorectal cancer screening. I agree with what the patient navigator talked to you about. Can you bring that in next week? What I would say to a colleague who's hesitant to offer screening to someone 45 to 49 is that nowadays, insurance companies have about a year from when guidelines are first released to when they have to pay for it. So at this point, we're right around that 12-month mark. And so there shouldn't be many health plans that are not covering screenings at this point. So early on, I can see that being a challenge. But at this point, it should be much of a challenge. Most health plans, if not all health plans, should actually be covering screening. What sometimes can be a challenge is getting those patients in for colonoscopy because of the access for colonoscopy or the capacity of that practice to be able to do colonoscopies. So one of the things that we're finding helpful is maybe starting with a stool-based strategy for those individuals 45 to 50 and then going with colonoscopy for those who are 50 and older. That strategy seems to be one that makes it easy for patients to satisfy, as well as one that's more accepted by health plans. Now, with that being said, there are also patients who may have a family history of colon cancer or may, for other reasons, be at high risk for colorectal cancer. Those individuals absolutely need to have a colonoscopy done, and those often are covered by insurance companies because of the high risk status. I'm a very strong proponent of stool-based testing. That's been the key for us achieving the results that we achieved. And we actually were able to reach 80% screening in 2018, largely because of our stool-based screening approach. There's been a lot of debate in the medical community as to which test should be recommended, stool-based test versus colonoscopy. And I think in most of the professional circles, many would agree that the best test to offer is going to be the test that gets completed. And what we know, there's a study in JAMA that looks at patient preference. And they found that when offering patients a choice of whether they should have a colonoscopy or stool-based test, those who were given the choice completed their screening at much higher rates than those that were just giving either one colonoscopy option or just a stool-based option by itself. And so the best recommendation is to offer a patient a choice, stool-based or colonoscopy. What we find is that there are a considerable number of patients that just aren't ready for colonoscopies. And so for those individuals, it's always reassuring to them that there's another option that's available. It's a one that doesn't require a bowel prep. They can be done in the convenience of their home. It doesn't take long to complete. And it does work. It's very effective. Something else just recently was the pandemic. We were actually looking forward to pushing more colonoscopy the year 2020 because again, we had worked so hard to raise our rates through stool-based testing that we really want to kind of move away from stool-based testing and try to get our patients up to date with screening that provide more length in between intervals, right? So doing colonoscopy that gives them like a 10-year interval in between screening, or doing more of the stool DNA test that gives like a 3-year interval in between testing. So we really were going after colonoscopy in 2020. And of course, early in the year in March, we were one of the super spreader, had a super spreader event here, and one of the main sites in the country with was a hotspot. All the hospitals shut down the elective procedures at the time, and so we were forced to go back to our stool-based approach, which for us, it was a quick pivot and allowed us to still maintain a high level of screening throughout the pandemic, where other systems really would hit hard because they relied largely on colonoscopy screening for their patients. And so for us, being able to mail out fits to the patient home, still able to communicate with them, whether it's over the phone or telehealth services, was very effective in keeping our screening rates high during the pandemic. The key for stool-based tests is that you have to repeat them every year. The great thing now is that there are more advanced stool-based tests that are on the market. And so in addition to just testing for colorectal cancer, there are 2 stool-based tests now that also can detect colon polyps, which is an advantage. And then pretty soon there may actually be blood-based tests that are coming to market that will even make it even easier for patients to comply because they just have to get their blood drawn for testing. So in the coming months to years, it'd be very easy to overcome some of the barriers that patients face with adherence to screening. Some of the resources that were most effective for us were the ones that were published by the National Colorectal Roundtable. I was shocked but pleasantly surprised of the wealth of material that's available on their site. They have material that is geared toward community health centers, geared toward private practice, geared toward hospital settings, and it really walks you through the steps of colorectal cancer screening. And so there's one that's called the STEPS Guide, and it goes step by step of how to set up your screening program for success. It talks about some of the barriers to success. It talks about dealing with electronic health records. So I would recommend the National Colorectal Roundtable's resource guide. Not only does it have a STEPS guide, but it also has information on communication guide. So those patients that are more likely to not be up to date with screening, populations like African American populations, Latino populations, Asian populations that may have a lower screening rate than some of the general population, there are communication guides that are available there that give you tips and key phrases and statements that you can use that will help make the recommendation easier for that patient to agree to.